No, she's got it.
Hi, my name is Brianna. I'm going to be your student nurse today. I'm going to go ahead and close the door or curtain for patient privacy. Can I please, will you state your name and date of birth, and can I see your wristband for...
Khalil Duran, November 4th, 2010.
Perfect. Awesome. Alrighty. So today we are going to do a physical assessment on you. Do you have any allergies?
Not that I know of.
Alrighty. And any pain today?
No.
Okay. So I'm going to go ahead and sit down. And then do you know where you are?
In a hospital.
Perfect. Do you know why you're here?
For a physical assessment.
Awesome. And then do you know who the President of the United States is?
Joe Biden.
Okay. So patient is alert and oriented times 4. So do you feel safe here and at home?
Yes.
Perfect. And do you have any thoughts of hurting yourself or others?
No, I do not.
Alrighty. And do you wear any glasses?
No.
Alright. And what did you eat today, starting with breakfast?
Cereal.
And then for lunch?
Pizza, pepperoni pizza.
Awesome. Have you had dinner yet?
No, I do not have dinner.
Okay, then we will hold off on that. Do you eat 3 meals a day normally?
Yes.
Okay, and then how many glasses of water or juice do you have a day?
Water, I have a quarter gallon. Juice, at least half of that.
Okay, perfect. That sounds good to me. Do you sleep okay at night?
Yes, I do.
Alrighty, and then how many hours of sleep do you normally get?
Either eight mostly, or 10.
Alrighty, that sounds good to me. Do you exercise or play sports?
I do exercise.
You do? And then what do you do for exercise?
I listen to music and act.
Awesome, that sounds awesome. Alrighty, so I'm going to start by checking your head. I'm going to check for symmetry. I'm going to check for any infestations, lumps, scars, or pain. Is that okay?
Yes.
Okay, so I'm going to start by touching your head, okay? Alrighty, so we're going to feel through. There's no lumps. I'm going to check every inch for any infestations. So your head is symmetrical. There's no infestations, no lumps or scars. Was there any pain?
No.
Alrighty, so no pain. Next, I'm going to check your eyes. I'm going to use my pen light. It's going to be a bright light. Is that okay? Okay, so I'm going to just shine in each of your eyes. Ready? Alright. Perfect. And then you're going to go ahead and follow the tip of my pen, okay? Perfect. Awesome. Alrighty, so pupils are equal, round, reactive to light, and accommodation. So next I'm going to go ahead and check your ears. I'm going to pull your peanut down and back. And then I'm going to go ahead on the other side. Alrighty. So there is no occlusions and no redness or swelling. I'm going to go ahead and have you look up at the ceiling. I'm going to check your nose for you. Alright, and then septum is midline, no deviation, no occlusion, and mucosa is pink and moist. So then I'm going to go ahead and have you open your mouth and say ah. Perfect. Alright, so patient has a full set of teeth. There is no swelling, no occlusions. Mucosa is pink and moist, and your uvula is midline, okay? So then I'm going to go ahead and check your respiratory system. I'm going to first go ahead and touch your chest and your back. Is that okay? Alrighty, so I'm going to go ahead right here. Go ahead and take a deep breath. Perfect. Alright, go ahead and turn to your left. And go ahead and one more time, deep breath. Alrighty, perfect. And then I'm going to have you take off your shirt. Is that okay? Alright, I'm going to listen to your breath sounds. I'm going to start in the front, okay? Alright, so every time my stethoscope touches your skin, I'm going to have you take a deep breath, okay? Ready? Alright, you're going to go ahead and turn to your left. I'm going to do your back now, okay? have you lift your arm up? I'm going to do your side. And then the other. Alright, perfect. Respiratory sounds are equal bilaterally, and there is no labored breathing. So then I'm going to go ahead and ask you to cough for me. Any shortness of breath?
No.
Alright, awesome. So then I'm going to go ahead and listen to your heart tones, okay? So I'm going to use my stethoscope. You don't have to do anything for me. Just stay still. And I'm going to listen to 5 points on your heart, okay? So we're going to start right here with your aortic. And then your pulmonic. I'm going to switch it to my bell and do your Erb's point. Perfect. Switch it back to my diaphragm, do your tricuspid. And then your mitral right here. Alrighty. And then S1 and S2 were heard. The pulses were equal. So I'm going to go ahead and have your hands out for me. I'm going to check your capillary refill, okay? Alright, capillary refill is less than 2 seconds. I'm going to also check for tenting, so I'm going to check right here above your wrist, okay? And then right above your collarbone. Alrighty, and then I'm going to go ahead and feel your skin. Skin is dry. It is normal for, it's normal, and then I'm going to go ahead and, your temperature is normal as well. So I'm going to go ahead and check your range of motion. So I'm going to have you squeeze my fingers. Perfect. I'm going to have you go ahead and push up on my hands. Perfect. And then down. And then move your shoulders forward. And then backwards for me. Awesome. So your range of motion is strong and your muscle strength is strong. So I'm going to go ahead and also feel your brachial pulse. And then your radial pulse. Alright, so pulses are even and rhythmic bilaterally. So then I'm going to go ahead and have you lay down now. Perfect. So when was the last time you had a bowel movement? So number 2.
Yesterday.
Yesterday? Was it normal for you?
Yes.
And then the shape and color, was it normal for you?
Yes.
Alright, and then what was the color?
Brown.
Alrighty, and then when was the last time you went number 1? Went pee?
Today.
Today? Okay, and then was that normal for you?
Yes.
Any burning, blood, or pain?
No.
Alrighty, perfect. So, I'm gonna go ahead and I'm gonna go ahead and assess your stomach. So I'm just gonna look at both sides. And then I'm also going to use my pen light and check for any shadowing. Alright, no shadowing. There is no bulging either. So I'm going to go ahead and listen to your stomach. Is that okay? Alrighty. So I'm going to start here at your right lower quadrant. I'm going to use the diaphragm. Alrighty. So bowel sounds are active in all 4 quadrants. So next I'm going to go ahead and percuss your abdomen, okay? So I'm going to start right here in your right lower. Right upper, left upper, and left lower. Awesome. And then I'm going to go ahead and palpate you. It might tickle a little bit. Alrighty, just let me know if there's any pain, okay? Alright, any pain during the percussion or palpation? No. Alrighty, so no pain and no bulging or masses felt, okay? And then, let's see, I'm going to do your lower extremities now. So I'm going to have you go ahead and bend your knees. And then go ahead and push out on my hands. And then back in. Awesome. Go ahead and straighten your legs. Push on my hands. And then back down. Awesome. I'm going to go ahead and feel your skin. Skin is normal temperature. I'm going to check for skin turgor right above your knees and on your feet. There's no skin turgor. I'm going to check for edema on both sides. So there is no edema present. And lastly, I'm going to check your popliteal your popliteal pulse, and then your heel pulse right here on your feet. And then your pulses are even and rhythmic. So then I'm going to go ahead and have you stand up. I'm going to have you walk towards the wall over here, and then back over this way. Perfect. So their gait is strong and even. Alrighty, so that is the end of my physical assessment. Do you have any questions for me?
No.
Alrighty, sounds good. So I'm going to go ahead and wash my hands and then exit the room.